Hello, my name is Tara Needham, and I am here at the UC Davis Department of Psychiatry and Behavioral Sciences. Today I'm going to talk about my work related to understanding early psychosis. So when we think about psychosis, oftentimes we think about a variety of different disorders, but all of these disorders, when they have psychosis, are characterized by specific symptoms. These symptoms include hallucinations, which is experiences in any of your five senses that aren't tied to reality, such as hearing things, smelling things, seeing things that aren't there. Delusional beliefs. These are thoughts that are held with conviction, even in the face of contradictory evidence, and motivate our behavior, such as things like thinking that someone has bugged your house and is listening to your every word. And you check your house and you are fearful because of what this person might be doing. And so you hold this belief even though you can't find any bugs in your house and that no one really seems to be listening to you. So those are hallucinations and delusions. We also tend to think about unusual or disorganized behaviors or speech. So unusual behaviors such as wearing 6 coats when it's 90 degrees outside, or speech that is hard to follow, confusing for the listener, as well as negative symptoms such as social withdrawal, a lack of interest in social relationships, as well as a loss of motivation for goal-directed activities such as work or school or chores or self-care. All of these symptoms together, or in little clusters, characterize what we call psychosis. Again, psychosis can be a part of a variety of different disorders, including schizophrenia, bipolar disorder, as well as even PTSD. Now, many individuals with psychotic symptoms are fearful of seeking treatment because of their beliefs about what it means for them and their outcome. When we talk to individuals, they're often very worried that they will end up in jail, end up institutionalized, that they won't be able to achieve the goals they have for their life. And so a lot of my work focuses on trying to understand what predicts good outcomes, such as having friendships, having relationships, being able to spend time with our family and enjoy it, and being able to graduate from school. So we're very focused here on trying to understand predictors of outcome related to psychotic illness. My research here at UC Davis focuses on factors and understanding factors that contribute to various outcomes in youth and young adults with early psychosis. And most of my work has focused in 2 predominant areas. One, understanding aspects of cognition that predict psychosis risk for individuals who are at high risk for psychosis using technologies such as functional magnetic resonance imaging, or fMRI. I also have another project looking at clinical predictors of relapse using smartphone technology or mobile health technology. I have a number of other studies looking at a variety of things, including social cognition and its relationship to aggression in individuals with psychosis, understanding the effectiveness of early psychosis treatments here in the state of California, and seeing if we can use technology to identify individuals in our community who are experiencing psychosis so that we can get them into treatment faster. So the first area of research that I have been working on is trying to understand how changes in brain functioning contribute to risk for psychosis. We have clinical interviews that we can do with youth that examine different early signs of psychosis. So I mentioned that some of those symptoms of psychosis, like hallucinations and delusions, such as seeing people or hearing voices. In the earliest stages of the illness, those might be things like seeing shadows, hearing mumbles, whispers, maybe wondering if someone is listening to you, but not believing it with full conviction. Those are what we consider to be early signs that someone might be at higher risk for psychosis. But these early signs aren't completely predictive of psychosis. When we find individuals who show these early signs, about 30 to 40% of them will go on to develop a psychotic illness. But that means there's 60 to 70% that won't. So we really need to try to find other ways to identify those individuals who are at highest risk for psychosis so that we can provide them with targeted early intervention to prevent worsening of their symptoms or prevent them from failing out of school or losing their job. So one potential area for that is looking at cognition. Now, we know in psychotic illness that individuals who experience these symptoms also have challenges in areas such as attention, working memory, being able to hold information in mind and use it to guide their behavior. So we have a number of different tasks that we can use to measure these cognitive impairments. And these cognitive impairments are specific to the prefrontal cortex, or this part of your brain. And we know from a variety of different studies that in individuals with psychotic symptoms, many of them have trouble engaging this part of their brain in order to perform these tasks in the same way that healthy individuals would. So I use these sorts of paradigms in individuals at risk for the illness to see if we could find the same weakening of these cognitive abilities. And what we see is that individuals who are at risk for psychotic illness also show impairments on tasks that measure this prefrontal functioning. So here in this slide, you see a slice of the brain. And this little area right here is a specific area of the prefrontal cortex that has been shown to not activate in the same way for individuals who have psychotic illness. And when we give them a task that really tries to engage this part of the brain, we see that healthy individuals, when they're asked to engage on this particular task, really increase their activation of this brain region. Whereas individuals who have psychotic illness or individuals who are at clinical high risk for psychosis don't activate their brain in the same way. And so this suggests that changes in this particular brain area and the associated cognitive functions may be another risk marker that we could use to identify youth who might be at greatest risk for future psychosis. Shifting gears a little bit, I also have a study that is using mobile health technology to track early clinical signs of relapse. For individuals with psychosis, approximately 80% of them will experience a relapse, which means a worsening in their psychotic symptoms, such as an increase in their hallucinations, a worsening in their delusions. About 80% of individuals will experience a relapse within 3 years. So we have a number of individuals who begin to struggle as their illness progresses. And so it would be very helpful if we could identify early warning signs that someone might be at risk for relapse so that we can intervene early and hopefully provide them with the support they need so that their symptoms don't continue to worsen. One way to do this is to use mobile health technology or an individual's smartphone to see if we can track how they're doing on a daily basis. So we have an app, and individuals have this on their smartphone, and each day they complete a number of questions related to their mood, their socialization, if they're taking their medications, and then each week they also provide answers to a number of different early symptoms such as changes in anxiety, depression, some of those subtle hallucinations and delusions I was talking about, to try to see if we can pick up on these early signs and symptoms. And what our data has shown is that 2 weeks prior, if we look at an individual's depression, we can see that an increase in depression 2 weeks prior is associated with increased hallucinations and delusions 2 weeks later. So a worsening of depression 2 weeks ago means that my hallucinations and delusions could be worse today. Similarly, my anxiety 2 weeks ago could be associated with an increase in my hallucinations and delusions today. And a decrease in my sleep, the number of good nights of sleep that I get, would be associated with increased aggression and mania. So fewer nights of sleep, more aggression and mania. If I get more nights of sleep, then I have less aggression and mania. So this data shows that we can use individual smartphones and data collected by them to help us find early warning signs that can help us target treatment to individuals who need it most. Why is all of this important? It's very important for people to understand that psychosis is more common than you think. Within Sacramento County alone, each year, over 600 individuals will experience the onset of psychosis. That's a large number of folks who are beginning to struggle with these symptoms and families that are being impacted by it. It also impacts our community, our health system, our schools, and our economy. This is very important for us to try to understand, both to prevent worsening for individuals who have the illness and to try to prevent illness onset for those individuals who may be at greatest risk. I am also the Director of Operations for our EDAPT clinic, our early psychosis program here in the Department of Psychiatry. And so when I'm meeting with clients and their families, The first question I get is my child going to go to college? And individuals want to know if they're going to get married or have kids. These are really important pieces about just having a normal life that are very important to the individuals who are affected by these symptoms and their families. And our research should really strive to answer these questions for them. So we really work hard to try to find answers to help them have a meaningful life, have hope for their future, and I really believe that this research will help pave the way for better outcomes. I want to thank my mentorship team and the resources that they have provided me. Cameron Carter has been a significant mentor. I've also received mentorship from Dan Ragland and Marjorie Solomon, all of which are in the Department of Psychiatry. I've received a lot of mentorship from my peers who are same age faculty as myself who've supported me in this work. And then I think it's very important to acknowledge the support that I've received from the university, including a Tupin Award from my department that has supported my fMRI research, support from a biostatistician that has been part of our department. I've also received departmental review that has helped to support my K23 and my R01 applications to NIMH. And I've obtained multiple pilot grants and travel awards from UC Davis. Thank you so much for your interest in my work. I really appreciate your time.